Now to this morning's Health Watch. Cases of measles just hit a 33-year high in the U.S. Health officials have reported 1,288 cases this year across 38 states, though most of them are in Texas. CBS News medical contributor Dr. Celine Gounder is editor-at-large for public health at KFF Health News and joins us now. Good morning. What is driving the case increase now?
Well, as we know, the vaccination rates for MMR, measles, mumps, rubella, have not been high enough to prevent community transmission. So we've seen this big outbreak in Texas, but now spillovers into other states, so smaller outbreaks in other states. We're also seeing importations from other countries, so returning travelers from outside the country is driving some of this as well.
The MMR vaccination rates have fallen nationally 2.3%. It seems like a very small number, but you say that small number can still have a huge impact. How?
Yeah, Dana, measles is really the most contagious infectious disease known to man. And so as a result, the levels of vaccination that you need to prevent transmission are exceedingly high. So you need to have over 95%. So yeah, you might say 92.7%, which is the sort of average right now among kindergartners. That might sound pretty good, but it's not. It's not nearly enough. And especially when you consider that many communities are well below that, we're very vulnerable to having these kinds of outbreaks.
What age can kids get the MMR vaccination? And then if they're too young, what do parents do?
Right. The CDC recommendations have been 12 to 15 months for the first dose and then 4 to 6 years for the second dose.
Okay.
Now, that said, that is in the context of we had quote, eliminated, so stopped community transmission of measles. Those recommendations were based on that context. The World Health Organization in other countries will recommend a first dose as young as 6 to 9 months. And frankly, pediatricians may want to start thinking about giving an extra dose at that earlier age, particularly in a community where there is active transmission.
Right. Dr. Celine Gounder, thank you very much.